I'm heard. Very good, very good. Thank you so much. Thank you. Nice to see you all, and thank you for coming here for a topic that I think all of us are struggling with right now as qualitative researchers. And for me speaking to you this afternoon or this morning, wherever you are, some of you it's morning, and some of you it's evening, like the Philippines. I know that we are struggling. We're struggling with this issue of COVID-19, and we want to see how we can do it while we are confined. And basically, that's what we're going to talk about. And if I talk about this today, it's not because I'm an expert. I'm simply sharing some of my opinions. And this is something that we're working on with Dr. Costa, Dr. Antonio Costa, who is the president of, I think, either vice president or president of webQDA. We're trying to work on a paper that will address this issue. And at this time, it's something in progress. And with the discussion, the questions you're going to ask and the input you're going to give, I think we'll be able to come up with something that we can use and that can benefit many people. So let's get started with our topic for the day, qualitative research in the COVID-19 era. I think all of us right now are in this era. It doesn't matter where you are on planet Earth, we are all speaking about the same thing at the same time. To get started, I want to look at this cartoon that somebody just shared a few days ago, and I thought it captured very well what we're dealing with. Several years from now, many of us will be grandpas and grandmas, and children will come, our grandparents, or our grandchildren will come, grandpa or grandma, tell us again the story of what life was like before COVID-19. If you're like me, and I think you are, up until January, you had plans for the rest of the year. I had tickets that were taking me to 3 or 4 different continents that were already booked and everything. And now I had to cancel everything. The hotels that I had booked have been canceled. And this is because something has changed our mind. So when time comes to tell this story will probably go something like this. The children will ask us, where was it from, this COVID-19? And we'll tell them it was somewhere from Wuhan, Hubei province in China, a place that most of us have never been. And we will probably tell them this thing started somewhere around December 2019. And we'll tell them that there were several theories from bat or pangolins or chemical or biological warfare. That is what people used to think that was the origin of this COVID-19. And we will eventually tell them that at first it was something like it was going to be contained, but later on, the World Health Organization discovered that we're not going to contain it. It had gone to all the continents, and therefore WHO declared it as a pandemic. We'll probably tell them about the stories of total shutdown, where schools were shut down completely, churches and businesses and communities were all on shutdown. We'll probably tell them about the travels that we had planned for 2020, but it didn't happen anymore, that the airlines had closed all the flights, and communities, total communities and cities were on lockdown. We'll tell them that some of the countries, there was no way to go in and to go out. We will tell them about some of the saddest stories of those who are the most vulnerable people when this COVID-19 pandemic hit the world. We'll probably tell them about the health professionals who were in the front line, who had to face death in the face every single day. They went to work in the morning and they never knew if they will ever come back. We'll probably tell them about the security guards, the security personnel who had to try to keep everyone inside so that people will not be contaminated or contaminate other people. We'll tell them about the vulnerable population of the homeless people who had nowhere to be locked down to. They had to continue living on the street, and they lived an invisible life because, you see, they didn't have a place that was called home. We will probably talk about the elderly who became the very first victims of this pandemic because once they were contaminated, their chances were much lower than most people to survive. We will tell them probably about a lot of innovative ways, of dealing with the COVID-19, washing hands, sanitizers, masks, and all kinds of masks that came up to show that people were serious to try to avoid contaminated, because once you were contaminated, there was no cure at that time. So people had to come up with all creative ways. We'll probably tell those grandchildren how many countries came up with the rule of social distancing in implementation for World Health Organization, that we had to keep a certain distance if we happen to be in public. We will probably tell them about the financial crisis that came as a result of this pandemic. We will tell them about the story of staying home for weeks, if not months, because going out was not an option. It was too scary. Maybe some of us who are teachers, and I think many of us are teachers, we will tell them about the story when we started the semester. I think this is one of those cartoons that capture very well what is happening in education, that the semester started very energetically. Everybody wanted to do their very best. And then all of a sudden we're told to move to remote teaching education. And quickly plans had to be put in place, and the actual teaching became just a tiny little leg, which is the reality that is happening. In the end, we'll tell them there was a dead end. There was a dead end because nobody knew what was going to happen. Nobody knew how long it was going to last. Nobody knew how to deal with the issue. We'll tell them that it became like an impossible mission, and that people were grabbed with fear because nobody knew where this invisible enemy was. We'll tell them about the thousands of lives that were lost. We'll tell them how quickly it went from January not having only one case reported worldwide to moving every 2 weeks. Just looking at the confirmed cases, the first day of January 2020, there was no case actually reported officially. Within the next 2 weeks, 282, the next 2 weeks, 9,000, the next 2 weeks, 49,000, next 2 weeks, 85, the next 2 weeks, 153,000, the next 2 weeks, a big jump to 750,000, and from there, almost a triple of that, 1.8 million as of 30 minutes ago. And our grandchildren will not understand how something could go so bad. From one case in January 1 to 115,000 in just 3 months, 90 days. We will probably tell them about this webinar, that we had a webinar and we had 20 countries represented, at least until noon time today, Kenya time, that there were 20 countries represented. And looking at Belgium and Brazil, we see an alarming cases, confirmed cases and deaths. We move into Germany, we see another terrible confirmation of cases. And we move into Italy and UK and USA. We will probably tell them the story that indeed it was a very, very bad situation. Of course, it doesn't matter where you're coming from. If you register before noon today, Kenyan time, you will see your country, where your country fits within this terrible situation. We'll probably tell them that although people had decided not to believe in God. At a certain point, people felt there's nothing else we can do. Let's just pray. Let's just read the Bible. And those who believed in a certain God, they started just praying because there was no other way. We'll tell them about people struggling to sleep, just to get some sleep, especially health professionals, because sleeping for them meant somebody's life was at stake. We will tell them probably some of the very, very heartbreaking stories, like the story of a medical doctor that went viral on social media, of a medical doctor, a female medical doctor who said, "My babies are too young to read this now, and they barely recognize me in my gear. But if they lose me to COVID-19, I want them to know Mommy tried really hard to do her job." And we'll tell them how this went viral and the support that people got. And the medical doctor to respond later on that the reason this tweet went viral is that it resonates with all those who are in the front lines, who feel similarly about the situation and would never know when the time would come for them, since they are always exposed. And then we'll hear stories and stories. We'll tell them about stories after stories of people who went to work and the next day they were no longer, because they were our heroes. They were our heroes who went to the front line. They wanted to make sure that we were protected. We'll probably tell them on the day of that webinar that was hosted by webQDA, in just 3 weeks, we had 1.8 million cases and 115,000 deaths. But recovery was coming, and we saw a number of recoveries getting much higher and higher and higher. And that started giving us some hope. We would probably tell them about the effects of stress that started from this fear. Everybody's scared of this coronavirus. We will tell them about the effects that were outlined by CDC, the fear and worry about your own health and the health of your loved ones, the changes in sleep or eating patterns because of being so afraid. I'm sure some of you will relate to that when you tell your grandchildren. So we'll talk about the difficulty sleeping or concentrating. You want to do anything, it just can't happen. We'll talk to them about worsening of chronic health problems, diabetes, and other chronic health problems that they just happen to get worse. We'll probably tell them about some of the hospitals that had to let some patients go because they had to cater primarily to the COVID-19 patients. We'll tell them about worsening of mental health conditions because of so much stress and fear that people start getting depression and getting mental health problems. We'll probably tell them about increased use of alcohol, tobacco, and other drugs for those who can still access that. This, we will tell them, led to automatic change, whether people wanted it or not. And that this led to the likelihood of a new era, a new time in history. We'll probably let them know how COVID-19 started a new era in 2020, and that automatically a lot of changes and innovations started, and they were linked to this COVID-19. New policies, new procedures, new guidelines, new models, new frameworks in life and in general. And that, at that point, there were changes in qualitative research. So, if our grandchildren happen to be researchers, we'll tell them about the problems that we faced as qualitative researchers. That there were closures of higher education institutions, transportation, hotels, communities, but that there was no physical contact There was no face-to-face interviews, that there was no observations that we could make because everybody was locked down at home. We'll tell them there was no way to collect documents from people if they were hard copies. We'll tell them that the IRB or ERB committees were closed because the universities were all closed, and a whole long list of things. But we will tell them we didn't quit. We'll tell them we decided to continue our work as qualitative researchers. So we will continue telling them that there was no funding opportunity because obviously the funding organizations were on lockdown. There was no advising for those who were students. There was just stress and fears and depression. COVID-19 had created something very complex that affected economy, tourism, restaurants, education, churches, human behavior, poor communities, and even moral values, where people had to decide, make certain decisions that have to affect the human life itself. But we'll tell our grandchildren, if we live to be there, that there was some good news for qualitative researchers. And that good news was that COVID-19 was definitely going to end. And yes, we believe COVID-19 will end. And that qualitative research is for complex issues like COVID-19. So basically COVID-19 has presented a lot of opportunities for qualitative research. Qualitative research does not require too many participants. That means if I can link up with a few people, a few nurses, a few medical doctors, a few security guards, I can learn a lot that I can share with people and actually generate some solutions from the ground, from the real life that can help many other people. We'll tell them that there was technology available to collect data virtually, that we could use Zoom, that we could use blogs and YouTube channels to get access to rich data that people were sharing because everybody was sharing all the time. Much qualitative research research can be done with limited funds. So we'll tell them we didn't actually have to have so much money. We didn't have to apply for so many grants to be able to do qualitative research, because we see qualitative research can be done with a few people. We will tell them about available prevention and the coping mechanisms that the World Health Organization kept developing and sharing with the whole world. So, what are the possible research orientations? Now that we have an ocean of qualitative research opportunities, we can look at how COVID-19 has affected human life. Just that alone, I think we can generate millions of qualitative research studies. Again, we can do it from our own houses. How people have coped with COVID-19 and its effects. And this, you can look at it from education to restaurants, businesses, for travel, tourism, banking, economy, management, leadership, and all kinds of things. Even the scientists who are not doing qualitative research, but they are trying to create the cure, the vaccines, they are also under a lot of pressure. So all this could be another millions of research opportunities that can be done. Different qualitative research methods to be used during COVID-19. The good thing with qualitative research is that it gives us to go an opportunity to go beyond what is even written in the books. Most likely, you will see a number of new qualitative research methods starting. And with this, we will be able to generate the data, to collect the data, and be able to conduct qualitative research. We'll discover weaknesses of existing research procedures, methods, designs, and frameworks because they simply don't work anymore in the current reality. We'll probably discover new qualitative research guidelines and policies for pandemics, things that did not exist before, because none of us who is here right now lived 100 years ago when, a century ago, when we had the last pandemic. And so most likely we'll see new guidelines starting. And we, as qualitative researchers, especially the group that is here, we can be in the front line of creating those guidelines. According to Cresswell and Path, qualitative researchers try to develop a complex picture. COVID-19 has created a complex picture for us, because it doesn't matter what aspect of life you are living, you will discover that you are affected one way or another. So it's a complex picture of the problem or issue under study. This involves reporting multiple perspectives. And yes, every time you talk about COVID-19, you'll find that it comes multiple perspectives. And the beauty of the data that is available, people are posting this on social media. People are posting this on YouTube. People are posting this in the news. People are posting this, we see this on TV. So we have multiple perspectives. And all these multiple perspectives can be captured with very different qualitative research methods. And this will lead to complex interactions with the data and with the people to be able to present a complex picture of COVID-19. So how do we go about data collection during social distancing? A few things we need to distinguish between social and physical distancing. Some people have written about this. When we were told to distance ourselves socially, actually, we can still reach out to many people and interview them virtually, because we are not prohibited to actually have social contact with people as long as we have physical lockdown. We can do online individual and group interviews very easily, online written focus group discussions. These are some of the methods that are already used, known. Interviews, written data in a public domain, big data and social media, all these are sources of data that can be used. I know we may have some questions about, how good is this data? Now, we're not going to discuss that today. We can conduct some smaller studies with fewer participants, because chances are the reality that people, nurses are living in India is the same reality nurses are living in Jakarta, in Indonesia, and the same in the United States, and the same in Italy. There may be some variations, but there will be a lot that is overlapping. We need to be more careful about ethical considerations, because this is an uncharted territory that we are entering. And so we just can't do business as usual. It is business unusual that we are dealing with. So we need to look at the university responsibility, since most of you most likely are affiliated with the university. It is unfortunate that many universities have shut down, especially in developing countries, but many, about 87%, the latest information I read, had migrated to online education or online platforms. And so with this, I'm hoping that the research aspect of the universities has not been forgotten. So the university needs to do something. They need to probably have IRB or ERB and research committees function virtually. They need to produce research guidelines adapted to COVID-19 reality, so that they know they can set in place policies and procedures how to go about doing research, using qualitative research to generate ways to reach affected communities, given that qualitative research deals directly with social life, with human life on a social aspect. This is the time when if a university wants to do something big in the community, to actually use qualitative research so that they can see the needs in the community, providing qualitative research capability building, virtual trainings, because obviously people cannot do face-to-face anymore. And then promoting more qualitative research production for new complex issues, given that the variables are not known yet, because this is a new phenomenon. Qualitative research will be the best way to approach research issues at this point. And here are some possibilities for those ERB or IRB committees. We can have a virtual university ERB committees, as I mentioned earlier, just recently, or virtual ERB independent organizations. I know we don't have too many like this, but they are not impossible. There are some organizations that are independent ERB organizations, and usually independent organizations that survive on how many projects they are doing. They may be able to catch this. And if you don't have some, this might be an opportunity for you within your country to start some virtual ERB independent organization that's recognized, and see if you could help with this. Virtual ERB government organizations that will help with funding, and ERB, for example, here in Kenya, the study, before the study is carried out, it's not only the university that has to approve it, but the government has to approve it also. And so this, the government needs to also come up with a virtual committee, virtual way of dealing with the approval of the ethics review. Use of data in the public domain, because data in the public domain does not need ERB approval. Opinion papers, you can write also opinion papers on qualitative research, like the one we're trying to write with this content with Dr. Antonio, because this is something, it's an opinion, but we believe it is something that can be helpful to many people. So you may have a good idea on how to go after to deal with the qualitative research. This is an opportunity for you to write that. The other thing that I want to emphasize on is we do qualitative research during this COVID-19. We need to do advocacy. What is advocating? It is, right now it is time to open up new spaces, according to Denson and Lincoln. Time to decolonize the academy. Time to create new spaces for indigenous voices, voices of the people who have not been heard. We have stories of COVID-19 out there that come from very poor rural communities, and nobody knows about that because everybody sees what is happening in big cities. Time to explore new discourses, new politics of identity, new concepts of equity and social justice, new forms of critical ethnography, and new performance stages. We need to find new ways of connecting persons. We find them in the community that they are suffering. It's just when I was, when I've been thinking about this presentation ever since we started talking about it, that every single day, while we think about the health professionals, the security people, personnel, and so on, from time to time, I remember the homeless people. Where do they call home? Where can they go lock themselves down? And their personal troubles. We need to match this with social justice methodologies. And I believe qualitative research gives that window of opportunity, because we can indeed tap into a plethora of methods that will help us get the voice of those who don't have voices out. How do we do this? Through qualitative research. We need to get those voices heard. We need to advocate for minority groups and the groups that are most hit by COVID-19. We need to have a clear agenda to address COVID-19 social issues as qualitative researchers. We need to make practical recommendations. Let's not just write qualitative research just for the sake of creating a new theory, but rather creating guidelines, solutions. This is what I will always require of my students, that the last research question of your qualitative research study should always be what recommendations can be made to improve the practice or to improve the theory. But in this case, we just want to improve the practice. We want practical recommendations to change life, to improve the life of people who are suffering from this COVID-19. We need to propose practical frameworks or models for social change. Right now, during COVID-19 and even after COVID-19 is over, we need frameworks to rebuild communities and social life. We need to connect the needy to available resources. It is true that there are a lot of organizations that are helping all around the world. Some are local communities that are getting together to help each other. We have international ones and national ones that are willing to help people who are struggling. So we discover through our research that there's a community that is forgotten somewhere, and we know of help that is being given somewhere else. We need to find a way to connect these two. So, the pursuit of social justice within a transformative paradigm challenges prevailing forms of inequity, poverty, human oppression, and injustice. So we need to make this our goal. Our pursuit should be for social justice. We should not do qualitative research only to get a lot of publications, but let's try to help. It is true that we're not scientists creating vaccines and everything, but we are here. For those who have made it to here, it's because we have that talent and that passion. I always believe that those who want qualitative research, they have the passion to transform lives. And so if that is what your talent is, or that is your calling, then let's push for the pursuit of social justice. Making systematic contacts with political figures, the media, the professional press, and with practitioners such as teachers, health workers, social workers, and government functionaries. All these are channels that we can use. Once we have learned from our research, we can show how qualitative work addresses issues of social policies. We can critique federally mandated ethical guidelines for human subject research. And last, we need to critique outdated positivist modes of science and research, because as we are dealing with COVID-19, these may not be the perfect ways to deal with what is happening. We have proposed a model here, a model that we think we can follow. Many of us, when we first heard of COVID-19, we were scared. And we call this a crisis recovery stages, and call it a COVID-19 recovery stages model. We're frustrated, we're stressed, we had anxiety, some of us got sick, sleepless nights, and so on and so on. But some of us moved to the next level, especially those who have already cases in your cities, that, hey, this is part of life now. But we are still discouraged because we watch the news every day. But then from there, we move to adjustment stage. Some of you, or maybe many of you, are already at this stage where, okay, life is here, but let me get something going on with my life. Let me continue with my work. Let me plan for next week, for this whole month, and so on. And up to this point, most of us are not going to accomplish a lot. If we are in the first three stages, we are probably not going to do qualitative research. We need to go to the last one, which is the productivity stage, which is where you say, okay, I have already accepted that COVID-19 is here, and until it's over, I want life to continue, and I want to make most out of the time that I have. Now that I don't have to spend so much time showering and doing all these things, I can save all this time and do something that I will remember over the years, that during the COVID-19, I was able to do this. I challenged recently, so for those of you who follow me on Facebook, I challenged you that, when people always say, I accept a challenge, people taking selfies and things, or showing a childhood picture and everything. And I challenged people there. And some of you accepted that, and I'm grateful to that. That as scholars, we should not be accepting challenges to take pictures. That's no challenge for a scholar. Accepting a challenge is to, like writing a paper right now on COVID-19 and qualitative research. and get it to be published so that it can benefit many other people. Now that is a challenge that scholars should accept. So while we are dealing with this stress, we need to move towards the productivity stage. And we know a number of strategies. You have learned about that. Keep busy with some scholarly productivity, spend less time on the news and social media, especially because they really, really can get you down. I think all of us went through this. Socialize while in isolation. Spend time with family and virtually call friends and get the stress out. Abide by the guidelines of the authorities and keep yourself in good health. And I don't know if some of you have come across this model of health. It's been around for more than half a century. It's called New Start, but even until now, it is still relevant. It stands for nutrition, exercise, water, sunlight, temperance, air, rest, and trust in God. For those who believe in a certain divinity, I know some do not, and that's perfectly fine. But you have this program, and if you go to this website, they will tell you the details about it. You'll find that you will be in a good health, that will be in a good mind to do your qualitative research. And of course, the other point is the time management. That has become a serious issue. Just keep in your mind that there's no time to waste on social media. Don't spend too much time there because this is inefficient and it leads to depression. Sometimes focus on research production, write papers, conduct qualitative research, collaborate with other people from around the world now that we are connected with the social media. Work on your daily routine and schedule. Work on your daily, weekly, and even monthly goals and try to reach them so that you are not wasting too much time. I will challenge you really that by the end of the day today, you will say, okay, by end of May or my end of June or July, I will have written this paper and this is the topic I want to write about, and try to target that and finish that. As I get to the end, I want to share with you my website here that Sonia had mentioned at the beginning. This website has all my books that I have written. I'm working on two other books right now. One deals with the online education, another one on qualitative research. And so if you want something practical to help you to deal with this just easily, just go to myresearchcorner.com. It's easy to remember, myresearchcorner.com, and you will get that. And some of you are on my Facebook group, Qualitative Research Teachers and Scholars. If you're not there yet, please join. We are able to share a lot. I'm sharing a lot of information there. And even others, everybody can share information, can ask questions there. There are some topics that people be sharing there. If you have topics that you want people to research on, you can share them there so that people have all kinds of ideas to keep going. In conclusion, as we leave some time for questions and comments, we have two choices really. We can decide to give up and stay in the first two stages of the COVID-19 recovery stages model, or we can decide to rise up and do something. And the reason why you're here is because I believe you want to rise up. And I encourage you that you'll rise up and that someday you'll look back and say, it's because of that webinar, just 1 hour webinar, that I decided to rise up and do something and forget and stop just spending too much time getting frustrated, but I decided to rise up and do something productive. So COVID-19 is not a total blockage for qualitative research. We can continue doing research, we can continue writing, we can collect data even without ERB data that is in the public domain. COVID-19 has generated several new opportunities for qualitative research. And so I would say if you have a paper that is published on COVID-19 right now, it is highly in demand, highly in demand. It doesn't matter which field you write in, Most likely, if you published, if you did a qualitative research now and you got it to the journal, they are going to try to give it a priority because they know how important the information is. COVID-19 is an opportunity for advocacy. We are locked down, it is true. Some of us may not be in a position to be going out there and taking care of the sick and delivering food to people. But we can write. We can use the data that is available to generate solutions, to generate recommendations, practical recommendations that will help improve people's lives. And last, COVID-19 is really a new era for qualitative research and life in general. Things will never be the same again. But let's be part of that change and let's try to lead that change to something positive. Thank you so much for your attention. We'll be open now for questions and comments.
Sonia, my name is King Costa from South Africa, from the Global Center for Academic Research.
Hello.
Wow, Prof, thank you so much. What a powerful presentation. Indeed, as qualitative researchers, we live in a new era. And I loved towards the end of the slides where you talk about advocacy, because qualitative researchers are problem solvers. And this is the time that we should be looking at methods and ways of how we can actually assist policy, even other scholars, by sharing experiences and using, academic research protocols. But again, there's something interesting here. You raised an issue of, for instance, how do we collect data? And obviously, in the time of 4IR, and they're already talking about 5IR, and the time that we live in, qualitative researchers should really be up to speed and observe and look at the changes, because yes, we live in an era of change. And thank you so much for a powerful presentation.
Thank you. Thank you so much, Dr. Costa. It's always a pleasure to interact with you. I know you're doing a great job there in South Africa, and not just South Africa, Southern Africa. I know you're doing a lot of work there, and I'm just so glad that you came. And I hope some of your colleagues and students have been here, and if they have not, please share this video with them when you get the chance, when the video is, the recording is sent to you. Yes, somebody has asked here if we are able to access the presentation. Yes, this was recorded and it will be shared with you. It will be shared with everyone. The actual presentation may not be, because we are working on a paper on it. Once the paper is done, then the presentation could be also sent. But definitely the actual recording, you're going to have a copy of that.
Yes, we will send it tomorrow.
Thank you, Sonia.
Are there any more questions? Does anyone want to enable their microphone? And there is a question in the chat window from Ana Isabel Rodrigues. Hello, Ana.
Okay, do you think that will be a change regarding ethical approach in qualitative research because of COVID? I definitely believe so. At this point, I don't know what changes will happen, but this COVID-19 will change a lot of things. And yes, there will be some changes that will happen in qualitative research ethics. I don't know at this point what it will be, but it will be interesting to see a year from now how it is going to be. Meaningful trusting. Okay, somebody said, Julianne, it can be more challenging to create meaningful trusting relationship with potential participants during this time. Do you have any suggestions? I would say at this point, it is good to start with your own community, because if I had to interview somebody like a medical doctor, like right now I'm in Nairobi, Kenya, Let me say I want to introduce somebody, a medical doctor in Italy. They never heard of me. I just happened to know their Twitter account or something. I mean, that will not be really easy to do. Why not work with my own medical doctors here in Nairobi who are dealing with COVID-19? So I would suggest that we start with what is around us, and that is perfectly fine with qualitative research. Okay, any other question here? Yes, Carla, if you want to join the qualitative research teachers and scholars, feel free and share it with other people. There's a lot of resources there. There's a lot of discussions that happen there on a regular basis. I personally manage it, and so I check it several times a day. And so please join us and feel free to share with other people. Steve, the same thing, please feel free. The address is, the name of the group is at the bottom of the screen, Qualitative Research Teachers and Scholars. And if you want to go to my website, it's right there, myresearchcorner.com. It will also send you to the same information. Thank you so much, Felipe. I appreciate your comment. Let's stay in touch. De La Salle University, Manila. Professor Mitima Jean-Paul, I happen to know you personally. Would this instance also be a good opportunity to conduct studies that link health, public health, with other areas like education, environment? Oh, definitely. If you recall what we talked about earlier, is that this COVID-19 is a complex thing. You cannot talk about it without ramification to other areas. And so definitely, you can look at it, public health issues and how they link to education, how they link to business, how they link to churches and all kinds of things. I know you're in the linguistics. It may be a good idea to check how the language is also evolving during this COVID-19. I don't know if there's something there, but we can look into that also.
Okay. Hi, Dr. Safari. I think that will be fine. Also, a possibility of seeing, especially, because not only linguistic, but also in development studies, how this is affecting other areas.
Very good.
Yes, okay. Thank you so much for a great presentation.
Indeed, it'd be nice, Professor Mitima, if you could come up with a model, like a linguistic development model. You see the model that I created here. It's still a work in progress. By the time we publish it, hopefully it will be strong. You can see if there's something that happened, how language was used before, how it is used during COVID-19, and when it's done, do we see changes in how people are using the language? New vocabulary that comes in, for example, in how people are handling the sick, how the security people are handling the people. I mean, there's a lot of linguistic things happening.
Yes. Okay, thank you so much.
All right.
Safari,
yes.
We have a question from our friend Philippe in the chat window, which is, I would like to hear from you some notes about the emphasis in quantitative analysis that medical and scientific researchers have today compared to qualitative research results.
Can you repeat the question, please? I was trying to find it. I couldn't find it there. I think it was sent privately.
It's above Mitima's question.
Okay. I would like to hear from some notes about the emphasis in quantitative analysis that medical and scientific researchers have today compared from qualitative results. Quantitative research is about variables and testing hypotheses. Qualitative research, we are not trying to test any hypothesis. We're trying to understand what is happening with people. It is true that if we go into hardcore science, like those who are working on vaccine, they will use methods that we don't use in qualitative research. But their impact, the impact of those vaccines will change the culture. it will change the mindset, it will change the philosophy, it will change the worldview. Just to give you an example, right now here in Africa, right here in Africa right now, there seems to be a serious resistance to vaccine because of conflicting information that is coming out on social media. And so we, as qualitative researchers, we are going to try to understand what is happening with the people in the communities, how they are going to embrace this vaccine when it finally comes out, how they're going to embrace the testing of vaccine. That's what we are focused on. And I strongly believe, and this is one of the assumptions of qualitative research, we are much better situated in understanding that on a much more complex perspective than quantitative research would, because quantitative research will only capture a tiny little piece of the reality, while qualitative research will go into something much more complex. And so there are things that will need qualitative research for probably better understanding, and there are things that need quantitative research for certain things.
Okay, perfect. Yes, maybe Safari, if you agree, we have time for one more question, because our time is getting a little long now. I don't know if it's Juvenal who is trying to speak. Hello?
Okay. Hello. Thank you, Dr. Safari. I'm so happy to attend your presentation. Doctor, we are living a new era, is true. And we have problems with hiking. How may you explain a little bit more about confidentiality using this way of qualitative research? You know that we need confidentiality to keep and to make safe our people. We will interacting with them to keep secret information, as you know, how to do it in this way.
Yeah, thank you, Mr. Shinpimbi. It's good to see that you attended as well. A very good friend of mine in the Philippines. I don't know, you may be already back in your country, Angola, but it's good to hear your question, and that's a very sensitive question. And this is one of the areas where I believe that ethics guidelines will most likely change with COVID-19, especially when it comes to issues dealing with COVID-19. Because there are issues of privacy, there are issues of confidentiality, and we saw this usually when they report new cases in a country, the first cases of COVID-19. You'll find that governments are very, very, very careful not to reveal the identity of the person, because people can be easily attacked in the community once people know that somebody had COVID-19. And so I would say one thing that we discussed in Portugal in the last World Conference on what was it called, Sonia?
World Conference on Qualitative Research.
Yes, World Conference Qualitative Research that we had in Portugal just last October. Yes. It came to us, where one of the plenary speakers, or if not the keynote speaker, was talking about the impossibility of guaranteeing 100% confidentiality. I mean, privacy and confidentiality in qualitative research. Because if you're conducting a study in a community, let's say you remove the name of the person and all these things, of course. But when you use direct quotes, people in that community can guess who the person was. And so can we reach the rigorous confidentiality that is expected in research, we cannot. Practically speaking, we cannot. But we can do what is the best to be done. Following, for now, we just follow the guidelines that are available until new guidelines come up. Try to follow as much as you can. It is true that that person outside the community, the people will not know who the person is. But inside the community, they will probably know. And there are some conditions, some situations. For example, if you say, in this study, I interviewed the country director of World Health Organization. There's only one in that country. How could you state it differently? You can't. So right there, that person's identity is already revealed. But as much as possible, let's use all the guidelines that we can. And I think this article may be on my website. I published an article. You can email me and I can send it to you on how to deal with the ethical issues before, during, and after your qualitative research. I think that article, and this, I list things, I give lists of things. If you don't find it on my website, please email me or contact me on Facebook, and I'll be happy to share it with you. Or you can Google. You can just Google, you put Safari Wambaleka, and you put ethical guidelines for qualitative research, something like that. It will bring it, and you can download it and read it. That can give you already some head start on the issues of ethics. But it is a complex situation. Just do the best that you can do following the guidelines that are available today.
Thank you, Doctor.